Welcome back. We're talking about such an important topic today where we're discussing going beyond and advising PAs on the appropriate influenza vaccinations for their patients. My name is Dr. Jennifer Orozco, and I am the Chief Medical Officer for the American Academy of Physician Associates. And I am joined today by three PA experts in their fields: PA Takeia Horton, Dr. Sarah McQueen, and Dr. Melissa Soester. And I want to acknowledge that this discussion, and this very important discussion, is supported by Sanofi. And as we move into our influenza vaccine season and influenza season, we really need to have some important topics of discussion for providers and for patients. I want to shift us now into talking about specialties. Right. And we're PAs. We work in every specialty setting, you name it, there's a PA there. And is it really my responsibility depending on the specialty that I work in? And I'm going to throw myself under the bus. So I've been a vascular surgery PA for over 20 years. And the usual thing that happens in surgery, whether right or wrong, is we send patients back to their primary care providers to go get all of their maintenance and preventative work. And really how we've started to see a culture shift. And I think our hope is to educate that that is not the right approach. And when it comes to vaccinations, that every PA, every provider in every specialty that exists should be recommending vaccinations and influenza vaccinations specifically to their patients at every visit when it's appropriate. So I'm going to talk to my panel experts here around this, and I'm sure you have lots of lots of examples of this, since many of you worked in family medicine and emergency medicine over the years. So Dr. Soester, why don't you share with me a story? Share with me how this has happened, and what you've seen, and what you've seen from PAs or others who work in various specialties, coming to you and coming to your office.
Having always worked in primary care and worked in rural and underserved areas, for me, we always had flu vaccines on hand, but what we have to keep in mind is our patients are not going into a clinic or going to see a healthcare provider all the time. So if we work in vascular surgery, if we work in dermatology, if we're working in another setting, even if we don't have a flu shot in that setting, it's still something that we should be talking to the patient about. That may be the only touch point that they have with a healthcare provider all year. And so if we aren't taking every opportunity to bring those kinds of things up, I feel like we're kind of missing the boat a little bit on it, and staying, acutely aware in that community of where a patient can go if you don't have access to a vaccine in the clinic that you're in, because many specialty clinics are not going to have flu vaccines that are in that clinic. But I feel like if it's something that we are asking of every patient, hey, did you happen to get your flu shot yet this flu season? Even if they're it's unavailable there, maybe putting that in their after visit summary or talking to them about that, because there are countless patients that I see now in an urgent care setting that maybe haven't been in to see primary care, and there's huge primary care shortages as well, but they haven't been into their primary care office, and maybe they were in orthopedic surgery to have a procedure done or have an injection, and they haven't really seen anybody else, and I'm seeing them with a positive influenza vaccine. I can't help but think, did we miss an opportunity there to at least, recommend that they get that vaccine?
Well, and I think that, flu vaccines are everywhere. And if you took 2020 to 2021 season, more adults received their flu vaccine at a pharmacy or a retail store than at a provider's office or at an HMO. So, but people make the assumption, and I will say a lot of providers and healthcare providers in general make the assumption, well, I don't carry the vaccine in my office, so therefore I don't have to talk about it or make recommendations to my patients. So, Dr. McQueen, share, what do you say to that? Help people understand when I say stuff like that. Oh, it's not my responsibility, I don't carry it. What do you say to that?
I think you need to take a second look. I really do. I look back at my own mother, she had a knee replacement, and I watched, for 6 weeks, she did not want to go anywhere she didn't have to. And that would include, she's definitely not going to Walmart. She's going to physical therapy and back to the house to put her ice pack on her knee. And so that's really, if you're in orthopedics, it's very dangerous. Do you really want your hip patient to end up with the flu and stop their therapy and then lose out on precious range of motion time, or even worse, get pneumonia because they're not moving around? And it's my hem-onc folks, the oncology, really take a look at your patients, because they're coming into your office, but do you really want them sitting in line with all the sick kids who are passing around RSV, flu, and everything else they got at school? Because that's what they're going to find in my waiting room, whereas your waiting room is more controlled. And so I would encourage to take a look at what your procedures, what your type of medicine, and how sometimes it alienates patients from their primary care for a bit. And it's not good. It's not bad. It's not good. It's just what it is. And because it's safer for them a lot of times to be in your office than going to the Walmart or coming into my sick clinic. Now with the pandemic, we've kind of made some changes where we can separate the sick that we know about. But it still really is an issue, and your recommendation comes really heavy. And I even think, I have a sweet child with a heart condition, and every visit the cardiologist would recommend the COVID vaccine, and the parent would decline. And I thought, man, this cardiologist did life-saving heart surgery on this patient 3 times now. I really think if they had that vaccine, they probably could have had an opportunity to give it. And so I think there is opportunity for specialty clinics to stock some of these vaccines, and maybe not forever, maybe just hold clinics where you get a supply of it for a short time, do clinics in your parking lot.
PA Horton, I want to go to you as we come to our final minutes here, because Dr. McQueen brought up a good example of a heart condition patient, a young patient. And this happens often in our young patients, right? Where they actually need like 4 and 5 vaccines this visit. And as a parent and as a mother of 3, I feel for you, because I remember those days when they were young and how heartbreaking that is when you're thinking about giving all of those vaccines. How do you as a provider help not only yourself work through how do you prioritize what vaccines that they get at that time, but also the patients? What is your approach, and really, how do you prioritize influenza vaccine over some others that may be a lot for a family to think about or to decide about?
I can remember many cases where people needed a shingles vaccine, a pneumonia vaccine, and a flu vaccine, plus their COVID booster. And they're just like, well, am I getting all of them today? I'm like, well, it's really, and I know I keep saying the same thing, but it goes back to a discussion with the patient. Risk benefits. We know that a lot of these vaccinations can be given together with limited or no side effects. And I explained to them that fever and chills and muscle aches you get could just be the fact that you got a shot in the arm and your body is now building an immune system response. But it's really a discussion with the patient. These are the vaccinations I see that you are due for today. These are the side effects of each. This is how, and it really depends on the season. If we're going into flu season, I'm definitely going to prioritize your flu vaccine and making sure you're up to date on your boosters and your pneumonia vaccine, especially in my patients that are elderly with comorbid conditions. And it just goes to listing like these are the ones I think are the most important. And then I always ask the patient the question, what do you think is most important? And then I ask them questions, concerns, and we make a plan together. If you want to get one today, another one in 2 weeks, another one in 2 weeks, I'm fine with that. I will do whatever the patient desires, just making sure they have the information and can make an informed decision.
PA Horton, it's so important. And I think everything that you've said in these last couple of segments, especially, and all of you, right, around communication and that importance of that relationship and that patient-provider relationship is important. So, this has been a really enlightening discussion. what is, and I'm going to do my final question here to each of you. If there was one thing that you had to leave this audience with around flu vaccination, what would it be? And Dr. Soester, I'm going to start with you.
Take each opportunity as it comes. If you see a patient and you have an opportunity to give them an influenza vaccine or talk to them about a vaccine, take a few extra minutes at that point and do that, no matter what kind of visit that they're there for, no matter what kind of specialty that you're in. Don't lose that opportunity to talk to your patients about the importance of doing that and helping to kind of just reinforce having a good positive relationship with them.
So many times we all want to practice good medicine and provide good care, but find a personal motivation, especially for vaccination. And for me, so I'm from Northeast Tennessee, so I have mammaws. My mamma was born in 1918. She got the Spanish influenza at about 6 months of age. She was in what I assume was a coma. The doctors declared her dead. They were getting ready to prepare the body, and she woke up. And you can, my sweet mama, she got Alzheimer's at the end of her age, and she would be in her 90s, but she knew fall meant flu. And so when those leaves changed, she was calling everybody down the road, down the street, every cousin, uncle, you better go get your flu vaccine. And so for me, it's hearing that story of my mama and how passionate she was about that. And so I do share that story sometimes of, everybody has a mama, everybody has a crazy aunt or something. And so find a motivation to recommend these vaccines, and then it's going to become commonplace to do it.
The most important thing I'm going to leave you with is treat your patient like your family. So engage them in a conversation, explain the risk benefits, answer all of their questions, and try and dispel some of those myths about vaccinations. And then, help them to come up with a mutual decision whether or not to get the vaccination. And don't take it to heart if they say no. Just because they say no today doesn't mean when they come see you in 2 weeks, they might not be like, I looked at all that information you provided me, and now I think I'm ready to get my vaccination. What you want to do is be a support system, build that rapport for your patient, explain everything, and feel like you provided them with the best information you could.
There's so much misinformation out there in general in the world today. And I think it has been so enlightening to have our 3 PA experts on this call really sharing some best practices as it comes to influenza vaccination as we enter this important season. And how what I heard today is how communication and relationship building and meeting patients where they're at is so essential for vaccinations. And you all do tremendous work. Thank you so much for being here. This has been a fantastic conversation. And I look forward to all that you do. And hopefully we get a few more vaccinations in arms this year as we move to the next flu season. So thank you so much. And I hope everyone has a wonderful day.